Hello everyone, my name is Irina Karpman and this is my presentation on population level health education intervention for week 7. The health related problems and issues based on the Healthy People 2020 that I identified, the first one is poor nutrition, very low food security among children. The second one is diabetes with high mean percentage of total daily calorie intake from added sugars. The third one is lack of adequate social and emotional support for mentally ill patients with a low percentage of local public health systems conducting public health system assessments, and drug addictions with low percentage of high school seniors never using illicit drugs. The indicators of poor nutrition and diabetes prevalence, I took this data from publichealth.lacounty.gov, and as you can see, Lancaster is here, the last line. Lancaster is here. So you can see that diabetes mortality is actually 90, and if you can see, all the other cities are much lower than that. So that's one of the significance of diabetes. Indicators of mental health, of mental and drug addiction problems. According to Kaiser Permanente, major depression has been linked to higher suicide rates, which is a huge problem in Antelope Valley, where Lancaster is located. 12.4 per 100,000 population. The Antelope Valley rate is much higher than Panorama City, and while the area overall falls within California rates, the Healthy People 2020 goal is less than 10.2 per 100,000 population. When looking at each of two areas, there is a noticeable problem in the Antelope Valley. And a key informant shared that there is no real infrastructure for adult mental health. Resources and services in the area are very sparse. So the objectives for diabetes are reduce the annual number of new cases of diagnosed diabetes in the population, improve glycemic control among persons with diabetes, and increase prevention behaviors in persons at high risk for diabetes with prediabetes. The objectives for nutrition are prevent inappropriate weight gain in youth and adults, increase the variety and contribution of vegetables to the diet of the population aged 2 years and older, and reduce consumption of calories from solid fats and added sugars in the population aged 2 years and older. The mental health objectives are reduce the proportion of persons who experience major depressive episodes, increase the proportion of adults with mental health disorders who receive treatment, and increase depression screening by primary care providers. And the substance abuse objectives include increase the proportion of adolescents never using substances, increase the proportion of persons who need alcohol and or illicit drug treatment, and receive specialty treatment for abuse or dependence in the past year, and reduce the past year in non-medical use of prescription drugs. Needs assessment. What I did in order to assess the needs of the community is a review of community health needs assessment and other supportive data online. I did the windshield survey, and I also interviewed the stakeholders. The theoretical framework and needs assessment. 4 major problems were selected. The selected problems were compared with Healthy People 2020 problems. In the proceed phase, I did defining the ultimate outcome, identifying the issue, the predisposing factors, and identify the best practices. And in the proceed phase, I did the educational material selection, identification of short-term and long-term objectives. And the issues that I identified is lack of desire to adapt to new behaviors among participants, mental disabilities that prevent from understanding the information, lack of resources, and also lack of social support. The interventions. The objective was increase prevention behaviors in persons at high risk for diabetes with prediabetes. The education provided was symptoms of type 1 and type 2 diabetes, and I also provide information about how to test if people are at increased risk for having type 2 diabetes. The next objective was reduce consumption of calories from solid fats and added sugars in the population aged 2 years and older. The education that was provided, it included healthy, low-sugar food choices, relationship between carbs and diabetes, meal tips, and exercise recommendations. The next objective for Class 3 was increase the proportion of adults with mental health disorders who receive treatment. The education that was provided included types of psychiatric medications, their side effects, tips on staying safe while taking the medications, and tips to avoid side effects. And the last objective is reduce the past year non-medical use of prescription drugs. The education that was provided included information on why people use drugs, information on prescription drugs, types of prescription drugs, statistics about prescription drug addiction. So the budget would include more education and social support has to be provided. Budget increase would include salary for social services and behavioral therapists at the clinic, and training is required in order to provide more information about community-specific needs. Project evaluation and outcome measurements. The objectives have to correspond with the Healthy People 2020 objectives. Data for previous and current years have to be compared in order to verify if the objectives were met. For example, amount of people with non-medical use of prescription drugs. An anonymous questionnaire could be appropriate. Results and conclusions. The main objectives is to provide more social support and education, and the main weakness is lack of psychiatric services in the area, unfortunately. Here are my references. I hope you enjoyed it. Good luck.